Great. Well, hello and thank you for joining me today. I'm here with Martin, Hamish, Blake and Mahika from Health New Zealand. And I'm here to give certainty to the people of Dunedin, Otago and Southland that the government will build the new inpatients building, completing the new Dunedin Hospital here at the former Cadbury site. We have listened. Last year, the government invested an extra $290 million towards the new Dunedin Hospital project, bringing the total funding for the project to $1.88 billion. Alongside this, the government is investing a record additional $16.68 billion in health over 3 years, so that Kiwis can access the timely and quality health care that they deserve. This investment into a new modern hospital will ensure that we can future-proof the provision of timely quality health care for the people of Dunedin and the surrounding Otago and Southland regions. It will mean 351 beds on opening with the capacity to expand to 404 beds over time. There will be an additional 20 short-stay surgical beds, a new model of care. There will be 22 theatres to increase access to acute and planned procedures with capacity to expand to 24 theatres over time. There will be 41 same-day beds to provide greater capacity for timely access to specialist and outpatient procedures. There will be 58 ED spaces, including a short-stay unit and specialised emergency psychiatric care, and 20 imaging units equipped with cutting-edge diagnostic technology for CT, MRI and X-ray procedures, with 6 additional spaces available for future imaging advancement. We are focused on delivering a safe, modern hospital complex with increased capacity that can adapt and expand in years to come to ensure it responds to changing needs. Our review of the project means the hospital will be future-proofed for growth, with no change to the number of floors to be built. It will provide clinical staff with world-class facilities and is designed to meet the needs of the community. The site will also be future-proof so new beds and services will be able to be brought online when needed. I know how important the building of this hospital is to the people of Dunedin, Southland and Otago, and I am pleased to be here today to provide that certainty on this issue. This is all part of our plan to ensure all New Zealanders receive access to timely, quality health care. I want to thank everyone who's been part of the process, and in particular the clinical leads who I met with this morning, who made it very clear to me this is the right facility on opening and has been future-proofed for growth. And with that, I'm happy to take questions.
How do you defend a new hospital that's going to have 16 fewer beds than the current hospital, where we've currently got beds in corridors? And can you tell us what the latest start date of the project is and the latest completion date?
Well, as I said, it's been future-proofed for growth. It has 20 additional short-stay surgical beds, which is a new model of care to provide additional capacity. It's got new theatres, additional theatres. It's got an increased ED space. It's got additional imaging capacity as well. This is something which the clinical leads have played an incredibly important role in playing, and as I said to me this morning, and they're very clear to me, was that this is the right facility on opening and being future-proofed for growth. In terms of your second question, the contractual negotiations are underway, and we will see activity on the site by the middle of this year.
When you say underway, does that mean that CPB is going to get the contract? And are there any considerations for PPP within this?
Look, the contractual negotiations with CPB are underway, and that's obviously a commercial negotiation. I'm not getting into the details on that, but ultimately that is underway. We've got a budget which we have set, and I expect those negotiations to be completed, and we will see activity on the site by the middle of the year.
Minister, you talked about expanding from 351 beds to 404 over time. Why not just put them all in at once? Well,
this is about how do we future-proof the capacity in the hospital, and so there's a range of opportunities or options that can be used in the space in the hospital. And so what we're doing is we're future-proofing it for that with additional space for theatres, for beds, for scanning. So as the needs change and develop in the region, there was the capacity for that to be able to be done.
Where's the PET or PET scanner national promised?
Well, I understand there's a mobile one here in Dunedin at the moment. There's space in the building for a PET scanner, but I might ask Martin, did you want to speak to that?
So that's a plan that we will work through now that we've got certainty around this very welcomed announcement on behalf of Health New Zealand and our Dunedin staff. It's a really welcomed announcement and we're glad the Minister's here to make it.
Did you answer the question about when the hospital would latest be built by? Did I miss that?
You asked about when construction would
I
start.
also
That was your
wondered
question.
built by.
All right, I think the latest by 2031.
And so, Minister, obviously you can hear protesters outside the building right now as we speak. Do you think they'll be happy with this decision?
Yes, we've listened. We've listened to the people of Otago and Southland, and what we've done is we have committed to the new Dunedin Hospital here at the Cadbury site. It was a very clear message, and now it is about getting those contractual negotiations completed and getting construction underway. But what I say, we've gone through a process to make sure we can deliver this within budget. That's really important. And one of my priorities as the new Minister of Health will be looking at our health infrastructure across the country, obviously here in this region, but across New Zealand, to make sure we are investing in the health infrastructure New Zealand needs so that New Zealanders can get the timely, quality access to care that they deserve.
Did those protests take a part in your final decision, or was it just a dollar and cents issue?
Well, look, I think ultimately we went through a process to make sure that we delivered for this region. We delivered within budget, but obviously we listened to what was needed here in this region as well. And so we've listened and we've come to a conclusion which allows us to deliver it within budget, whilst also, as the the clinical leads told me this morning, to deliver a facility that's the right facility on opening and has that capacity to grow and change as the needs develop over time.
But that decision-making in that interim period has blown out the opening for, what, 2 years?
Well, ultimately, we're getting on with it. Like, that's the point here. We're getting on with it. It's now to get contractual negotiations completed and get construction underway, and obviously we'll be looking at any way that we can bring that forward. But I'm here today to provide certainty to the people of Dunedin, Otago and Southland, and now we just want to get on with it.
Sorry, I was speaking with some of the protesters before coming in the room, and they basically told me that they would accept nothing less of the original plans. I guess, what is your message to them? They might be disappointed hearing this.
Well, ultimately, we've listened, and as the clinicians told me this morning, we've delivered the right facility which is required on opening. It has the ability to grow and meet those needs as they change and as they develop. And that's, I think, and we've kept it within budget. And I think that's really important. This is a really important region for New Zealand. There are also other regions across New Zealand which need investment in health infrastructure, and we need to make sure that we're delivering across New Zealand the health infrastructure that this country needs.
Does the clinical transformation group agree that it's a robust plan?
Well, the clinicians I met with this morning, I can ask Martin to speak to that.
Yes, the clinical transformation group are the people that the Minister's referencing in saying that on opening we've got the right model and it gives us future growth opportunity.
We understand that the Bowlane plant building is going to be not happening and the plant will be incorporated in the current building. Doesn't that equate to a cut of a floor?
I'll let Blake speak to that.
So one of the things through this process, we've been really focusing on things that aren't clinical space. We really wanted to protect that. So energy supplies to the building have absolutely been something that we have been looking at, in particular whether or not we can be part of the district energy scheme, which has been an important part of energy infrastructure in Dunedin. So those are the things that we've looked at to get this project back on budget and a part of the plan going forward.
Can you just put that in plain English for me? I'm sorry, I didn't quite understand how that's going to impact on the space in the building.
Yeah, so rather than investing in our own energy centre on Bowlane, we're looking at working alongside the district energy scheme, which provides energy to the hospital currently, as well as the university and other parts of the city, so that we're building less of that back of house infrastructure and can focus more of the budget on those clinical spaces, which are so important.
Brilliant. So to be absolutely clear, that's not going to mean any of the actual inpatient building is going to be used for that plant?
No, that's not. We're not moving plant into the inpatient building. We're looking at other ways of providing energy to the building.
And next, will the project be led by Crown Infrastructure Delivery or Health NZ or a combination of both? And who actually in Health NZ is going to be leading this now?
Well,
now Tony's gone?
Hamish is the head of infrastructure delivery at Health. Oh, sorry, Blake.
Yeah.
Blake, sorry, I got his name wrong.
So, absolutely, Health New Zealand is committed to leading this project. We are absolutely looking across government to where we can get the support we need to make sure we can move, like the Minister said, really quickly to delivery. So we're very grateful for the support that Crown Infrastructure Delivery has provided us and continues to provide us in making sure we can move ahead really quickly with this project.
And Blake, I know that you looked at both of the options, including the refurb. Can we have an absolute guarantee for the people of Dunedin that refurb will never be back on the table?
As I said, I'm here to provide certainty that this is the option that will be built, and that is what the government is committed to delivering.
Was it refurbishment ever a realistic option?
Well, look, we went through the exercise to ensure that we could keep this project within cost and within budget. And that's important because we need to make sure we are delivering the services this community and this region rely upon. But we also need to make sure that we're able to invest across the country. And so that was a process we went through. Ultimately, we've come to the decision we are announcing today, and we're moving forward.
And the decision that you're announcing today, was that made before you assumed the role of Health Minister?
Look, there's been various meetings right through this week. And we have now announced it today.
How do you feel about the inordinate delays to the project and the pain that it has caused the people of the South and medics working in such a dilapidated building with inadequate facilities, particularly given the national government promised it by 2000?
Yeah, well, I mean, if we're going to get political, so we could talk about the 6 years of failure under the Labour government. What I'm here to do is to provide certainty for the people of Dunedin, Southland and Otago. We're now in contractual negotiations. There will be activity back on that site in the middle of this year, and we are moving forward.
When do you expect those contractual negotiations?
Look, I'm not going to put a timeline on that because ultimately we need to make sure those are progressed, but that's what I'm here to do today, to provide certainty.
Are you able to say any particular role that your New Zealand First colleagues, particularly Winston Peters and Shane Jones, played in this development? Oh,
look, it's been multi-ministers who've been involved in those decisions and discussions, but I can say as a government we're focused on delivering for the people of Dunedin, Otago and Southland, and cracking on with it. That's our focus now, and we are working together as ministers because this region is critically important to our country and to this government.
How can you be certain that New Zealand actually has the expertise to deliver this project, given the multiple changes at the top in governance that have occurred? Is it just not the case that as a small nation we struggle to deliver infrastructure like this?
Look, we need to make sure we are much better at delivering infrastructure in New Zealand, and that's one. We've got to make a number of changes across government so that we are able to deliver infrastructure on time and within budget. We've seen huge cost blowouts across a number of infrastructure projects in recent years. We are focused on making sure we deliver that infrastructure, that we are getting better expertise within government because we need to make sure we are delivering and focused on that. So there's a number of changes. Honourable Chris Bishop's leading a lot of that work, working very closely with Minister of Finance, Nicola Willis, and also the Minister of Regional Development, Shane Jones. The four of us are very focused on this particular issue, not just for hospitals, but for roading infrastructure, rail, obviously a range of different infrastructure types. We as a country need to do a much better job.
Minister, these theatres and beds that will expand over time, is that included in the 1.8 billion or will that cost more?
Well, look, ultimately this is about being clear about what we are delivering on opening. Those needs may change over time as the needs develop and change in the region. But what we're doing is we're building the building to be able to then have further investment so that we can have that additional capacity as those needs develop. So that's the focus. That's the focus that I'm here to provide that certainty. And as the clinical leads told me this morning, this will be the right facility on opening. And as I said, it's future-proofed for future growth, depending on what those needs might be in the future.
Just two more questions.
Great.
This is about actually just squeezing subcontractor costs down to the right level and costs have been achieved.
No, it's about making sure we can deliver within budget, and I think that's something that all New Zealanders expect government to be focused on. Ultimately, we want to now move through the contractual negotiations, and as that does, get on with getting this thing built.
And finally, what are the plans for provision of hospital care in Queenstown Lakes and Central Otago, and also extra theatres and bigger emergency department in the Cargill?
Well, I mean, that's a really good question, and I think that goes to the heart of what I said earlier around health infrastructure is not just important to Dunedin, but to the entire country, and we need to have a long-term plan, and that's one of my focus areas. So that's where I've only been the minister for a week, as you can appreciate, but that is one of my focus areas that we'll be getting into. But look, thank you once again for being here. Really appreciate it. and appreciate all the questions. Thank you very much.